Welcome to this episode of Trachea Talk, where we're continuing our interview special series in 2025. Lina, one of our medical student volunteers, is chatting to Mr. Jonny Abbas. Jonny runs a company called EXR that make innovative virtual reality medical education for lots of things, but of course for tracheostomies as well. Let's hear all about it. Over to you, Lina.
Hello and welcome to Trachea Talk. Today we're diving into the world of virtual reality in healthcare training. Joining me is someone who's truly transforming and leading the charge in this field, Dr. Jonny Abbas. Jonny is an ENT surgeon, an NHS clinical entrepreneur, and has a PhD in immersive simulation. Threading all of this together, he serves as medical director and co-founder of EXR, an online immersive medical education platform. Jonny, it's really great to have you here. Thank you for joining. I'd love to give you a chance to introduce yourself and maybe tell us a bit about what you do.
Yeah, sure. Thanks for having me, Lina. I really appreciate it. Yeah, I think you've just said most of my main background, but yeah, I'm a medical professional. I'm training as an ENT surgeon. I'm sort of in the final couple of years of my training, and I've always had an interest in education and technology enhanced learning specifically. So I pursued a PhD, and Brendan McGrath was one of my supervisors. And that finished maybe about 6 months ago. And at the moment, I'm doing a bit of work, obviously my clinical work, and then I'm spending the rest of my work time either supervising PhD students or as a co-founder of EXR.
All right, that's so cool. It's such a varied background. What made you go from medicine and clinical training into a PhD in simulation? I feel like that's quite a leap. How was that transition?
That's a really good question. I think it was, I don't know, I was really enjoying clinical training, but I slowly started to develop an interest in education. And especially as COVID kind of came around, I was still in training, and obviously clinical activity was reduced. And I became more interested in how kind of new technologies, especially XR specifically, could help, I guess, bridge the gap when we were lacking educational opportunities in the hospital. And I started exploring it from that point of view. I started exploring it from a kind of meeting the demands, the educational demands of the system using technology. And it's kind of, yeah, I've kind of branched off from there, really.
Right. So it was through your experience in practice and seeing like limitations there and the need that you had that drove you towards feeling like you needed something a bit more in education. That's
definitely. And it was all sort of not thinking just about COVID. Even before that, I saw sort of emergency procedures that I thought there could be ways to kind of upscale education delivery. And I can go into some examples of that and sort of my first few experiments within creating educational resources. But I guess I was seeing gaps in educational provision in the current system and trying to find technology enhanced educational tools to kind of improve the provision of education. And where there weren't any, I've been working to create my own.
That's really amazing. I feel like it takes I don't know if it takes a certain type of person, but it is quite like forward thinking to think about technology to sort of resolve those gaps. I feel like you often in the NHS sort of just complain and just accept it. Yeah, so I feel like that's pretty cool. Were you always interested in tech? Is that why you sort of leaned into thinking about technology, or was there a particular technology that made you feel like, oh, this really helped, I wish we had more of something like this?
Yes, in a nutshell, I have always been interested in technology. So I probably would have a professional response to that question pre-prepared. But really, why I guess first thought of immersive technology specifically, so virtual reality technology is my primary interest. Probably what made me think about how useful that could be was in the early sort of creations of XR gaming. So there were certain games that I found incredibly immersive, far beyond any other gaming experience I've been involved with. And I've just thought, if I'm so immersed in this environment, doing this task, it likely could be translated into sort of medical education field. And yeah, so I started looking at the literature, I started looking at examples around that, and yeah, there are loads of people interested in the space. It's certainly grown kind of exponentially in terms of the literature also.
When you say like gaming, I think definitely games are so immersive when it comes to tasks and performing things and actually sort of getting you to learn a particular skill, even though it's just in a game. So it's kind of funny, but also like really relatable that that's where it kind of came from. Was there any was there a particular, just out of curiosity, was there a particular game that you found like really immersive?
So it's, do I want this to be public? No. So Half-Life Alyx, it was the game that I remember being basically totally immersed in. And I'm not actually, I've not grown up playing games much, but I just got into it during and before COVID. But yeah, Half-Life Alyx got me kind of crawling along the floor and diving on the floor to get out of the way. And I just thought, this is incredibly immersive to make a kind of 6'5" adult dive around his living room. Then I thought that actually it could be used to great benefit to teach.
Oh, right. So was it an actual virtual reality game? Like, oh, okay.
So goggles on,
imagine,
yeah, it was great.
That's really cool. Well, that brings us nicely to virtual reality training and EXR as a platform to deliver it, the teaching and learning. Could you give us a sense of what EXR actually is, what kind of learning it delivers and how it works?
Yes, so it's essentially a free, at the point of access, immersive technology education platform. So it is a web-based platform that hosts different experiences created across, over 25 NHS trusts, several universities and a few charities. And essentially it delivers specific educational content to either direct to a phone or tablet. But if you have a VR headset, the experiences work best on a VR headset. So it's really about the platform that's powering the delivery of content, and the content itself varies depending on what we've got asked to create. So I can give you some examples. There's quite a lot of equipment training on there for emergency pieces of equipment that might be required sort of very quickly, and they're used infrequently. An example of that is the rigid bronchoscope, which is used to remove foreign bodies from a child's airway. It doesn't come up very often, but the piece of equipment is quite complicated with various tiny components you have to fit together. So we've created a VR experience teaching you how to do that, basically. So there's equipment training, there's emergency simulation skills training, but there's also softer skills like communication skills training in there also. So EXR is really a platform that hosts lots of content that is co-created with educators around the NHS.
Right, that sounds like such a great way to bring different people's expertise together and sort of have one uniform, accessible way to reach a whole audience of like healthcare.
That is exactly why we created it. That's why anybody with an NHS email address can log in, or an ac.uk university email address can log in. It was to kind of link all of these people that are creating really good, academically validated, immersive technology educational resources and create a way for people to be able to share those resources and for anyone in the system to benefit, whether you were involved in creating it or not.
That's so incredible. Honestly, I saw on the website that it was free and, like you said, point of care for people who work in the NHS. But I was really surprised that not just that it was free for people that were in the NHS, which was in itself like really unexpected, but also that it wasn't just institutions or hospitals, but it was free for users and individuals, like you said, with essentially any healthcare staff. I do wonder though, like one question that came to mind was how is that sustainable or feasible for you as a company or as an organisation?
Yeah, I mean, it's the biggest challenge is to generate funding around the idea of a free to end user platform. But we have several ways that we've generated income and how we aim to generate income in the future. So the creation of the content, sometimes complex, bespoke content creation, requires us to seek funding. So sometimes we've had different sort of institutional departmental pots of money to help facilitate that. So the content may have not been created completely for free, but it's hosted online for free, so anyone can use it. So funding we've received from charities, we've received pots of funding from sort of national grants, but also we deploy the platform in other industries. So we create VR training for, say, the medical device industry, and there's a marketing opportunity for that. But also we have created immersive technology resources for completely non-medical industries that require a platform to power it. So we've done that most recently in the transportation sector. So there are other ways we're, I guess, exploiting the technology that we've created to generate revenue, with the central mission to keep all of the platform free to the end user.
Wow, that's so interesting to hear. I always wonder these things, but hearing how it actually works behind the scenes is really cool. And especially like ways to keep it free for, like you said, the end user, but still generate income in places that it is, or generate revenue from places that it's possible. And also the fact that you're using the platform for transport as well. That's quite unexpected. How is that?
VR training is kind of completely translatable across all industries, whether you're learning to set up flat pack furniture in a warehouse to learning to drive buses or maintain emergency vehicles. So whilst the content is not translatable to those sectors, so the content you see when you log in, Lina, on the platform, that's not relevant, but the platform powering the delivery of the content is. So we use that, deploy it into different sectors and create bespoke content for those industries.
Okay, so the medium itself is what's being used. That's really cool. Okay.
Oh, one small caveat to that as well is, we have to be quite creative with our funding opportunities. So whilst this is how I think most startups have this, but this is how we envisage creating this sustainable ecosystem. It wouldn't surprise me if things change as time goes on, but we're kind of okay with that.
Yeah, I suppose, I imagine if you're getting pockets of fundings from one place to make content and from another place, like medical devices, it's sort of like a pro and a con that, you've got the funding now, but not necessarily guaranteed for the future. So I guess it's kind of, it's exciting, I suppose, that you have to be adaptable, and if things could grow and evolve, you don't know where it could go. But yeah,
exactly. And largely we're led to a certain extent by the subject matter experts that we work with. I mean, across the 30 or so institutions we've worked with so far for the main XR platform, we've got loads of individuals that really get what we're trying to achieve, get what we're trying to do, and are helping us to do it. So there are lots of weird and wonderful ideas, which makes it very interesting.
Yeah. What was there? You mentioned that across your career and experience in medicine and in training, there were instances where you felt there wasn't enough training or particular gaps. Was there a particular moment that made you think this needs to change, or what was it that made you feel like virtual reality? You have kind of touched on this, but what made you feel like virtual reality was the tool for the kind of learning we need to have in medicine, or what was missing from the traditional learning methods that virtual reality could bring to the table?
So, I've thought a lot about that. So I guess if we talk in the context of, say, tracheostomy training, because we are on the Trache Talk podcast.
Yeah.
So essentially what through the National Tracheostomy Safety Project and Brendan McGrath and his incredible team, what they've demonstrated is the potential complexities to the care of a patient living with a tracheostomy. But they've also demonstrated that education and training around that can improve the safety profile of living with a tracheostomy. And how we currently how we deliver education and training for tracheostomy is through traditional simulation, which is fantastic. Of course, it's fantastic. It works. But it's difficult to scale that up to a workforce the size of the NHS or the global medical workforce. So you can say we can demonstrate that it improves safety, but if you can't scale it up to that level, then you're missing out potential patient safety gains there. So what virtualizing that using VR can, and what we've demonstrated through my PhD with Prof McGrath, is that potentially we can replicate the experience using VR at hopefully a fraction of the cost, a fraction of the required manpower, and then therefore deliver those learning outcomes at the scale that we need. Because VR is incredibly portable. If done right, you need a VR headset and some hand controls, and it's also limitlessly replayable. So a simulation session is not limitlessly replayable, so you can do it over and over again. So that's, I think, definitely working with Brendan and the team around tracheostomy care. That's a really amazing opportunity to fill a gap and widen access to this really important, particular educational content. Does that make sense?
Yeah, that makes a lot of sense. And honestly, it sounds like it could make such a profound change. I completely agree. Like, simulations are always amazing to be part of and take part in, but you can't replay it. You do try and recollect what exactly happened and debrief after. But if you could, repeat the scenario and do it again, I'm sure you would constantly improve. And if you could repeat it as much as you wanted, then until you feel like you had nailed it, then that would be amazing. And then also, like you said, being able to scale training to a national level or even internationally, and if it's proven to improve patient safety, then that could make such a massive change, particularly if it's at a fraction of the price, like you said. I think that could be really, really transformative.
Exactly, and just one other point, and it's not to diminish the role of simulation at all. Simulation, I think, is still the gold standard for emergency skills training. I think it probably always will be. It's just, I guess, when we don't have the resources as a healthcare system to scale that to the level we need to, that's where technologies, I think, can help. So it's not replacing it because the tool needs replacing it. It's giving educators another tool in their educational armamentarium to try and scale up workforce training, ultimately to provide training to as many people as possible to improve the safety profile, in this case, of living with a tracheostomy.
Yeah, absolutely. I think that addresses one of the questions I was going to ask anyway, which was the controversy sometimes with virtual reality sort of replacing certain skills or certain roles. But like you said, if it's working in tandem and alongside and supplementing real life training, then they could be a really powerful combination and duo together. Have you faced any sort of hesitation, like you mentioned, or doubt about the use of virtual reality in this healthcare space, and what's your take on that?
Yes, all the time. It is an evolving technology, and there are some significant nuances around it. There are some negatives to using it. So for some people, it's uncomfortable, and lots of people don't. I'm sure lots of people don't necessarily want to use it all the time. So, and then there's the kind of technology readiness side. So a lot of my PhD, I spent thinking about not just creating content and using it to impart educational outcomes. But I spent a lot of time thinking about how we usefully integrate it at scale within the system, within our healthcare educational system. And so there's a lot of work to be done thinking about the technology readiness of our healthcare system. And the first thing that springs to mind, a lot of the negative outcomes I've had through through working with EXR and through trialing and prototyping is simply internet access. So we still don't have universal internet access throughout the NHS that's reliable on devices like VR headsets. So this is one small technology readiness problem that we're facing. So there are skeptics, definitely, and whilst I'm a strong advocate of VR technology, I don't think it's useful everywhere, and I'm learning as much as anybody where it is useful, and I've made mistakes along the way.
That's really interesting to hear, and it is such a shame that something as simple as internet access in the NHS could be what's stopping this being scalable. But it's nice to hear that you've thought about, or technology like readiness is considered and bringing something into like the workforce. Were there any other like challenges that you faced in making this XR or tracheostomy training a reality, or a virtual reality?
Nice. Yeah, I mean, there's loads of challenges, which if there weren't challenges, VR would be everywhere and it would be ubiquitous and everybody would be benefiting from the technology. We've had challenges around funding, of course, because creating a free platform is always, we're always going to be facing funding constraints. But we've already talked about that. There are always technological challenges, and our technology has been reworked many times, and there's always ways to find new bugs, and it's constantly needed fixing and updating. And then the hardware ecosystem that goes along the software that I've created is kind of driving the software development too, because new headsets are coming out and we're trying to make it work on as many different headsets as possible. So there are new headsets and new companies always coming out, so we're having to keep up. And similarly, that usefully new technology standards are always being released, so we need to be mindful of that. And then I guess the last set of challenges, which is where working as an NHS surgical trainee really helps, is the kind of navigating the legal side and the permissions around immersive filming in an NHS trust. So a lot of the content on our platform is filming real patient procedures. The first of which we did in Older Hay Children's. We filmed a tympanoplasty surgery with one of their surgeons, Sunil Sharma, who's a brilliant guy. But there was a lot of working with the comms team and the legal team and the trusts almost at an executive level to try and get the required legal documentation signed and the risk assessments and things like that. So that's always a challenge, but it's a really nice challenge because people generally want to support what we're doing. So I've listed a lot of challenges. There'll be many more, and I'll running into challenges.
Yeah, there's a lot of things I hadn't even considered, like the fact that advancements in technology devices sort of has to push you to also make sure your software is compatible with those. Like that sounds quite difficult to me because I'm not a tech person, but I imagine that's quite stressful because technology is always like, there's always a new iPhone, there's always a new laptop. So having to constantly make sure your software is compatible is, I imagine, quite a challenge. But also, of course, like you said, the patient, I don't know if you'd call it safety, but like the ethical and legal aspects of filming
the governance process around filming, especially there's a governance process even around filming without involving real patients. So, but it's a challenge that needs to be overcome, and we have done that in the correct way many times. And but yeah, it does help that. So I didn't mention, but the co-founding team behind EXR, one of them, Nick, is a brilliant cinematographer, and he's filmed things for BBC and Disney, and so he's used to, from a film and TV point of view, getting the correct documentation signed, and so he's used to having those conversations. And then the other co-founder, Ben, is a games artist and games developer, and he's used to making the 3D assets he creates work on multiple devices. So we have an amazing team to help us, but it is still always going to be a challenge, these things.
Yeah, that does sound like the perfect team to overcome those challenges. But it also sounds like it's been quite a rewarding process for you. It does seem like you sort of
yeah, absolutely. It's been fun, and we meet loads of people that are really get what we're trying to do and are really supporting it, and that are really trying to drive the way. And we'll get confusing emails and confusing looks and complex forms to fill out and procurement documentation to go through. But then that's part of having a startup and part of innovating in something quite new.
So that's it for this episode. I hope you enjoyed listening to Jonny and Lina. Thank you to our guest editors and interviewers for their help in putting this episode together. Please note that the comments and the opinions of the authors and any guests are their own and not necessarily reflective of the organisations for which they work. As ever, please leave any comments on the social and chat functions on the website, and we look forward to seeing you again soon for the next episodes in this special interview series.